Good day to all my work teams is the mate of Laura Hernandez, Lina Castillo, Angie Garcia, Cristina Jordan, and Camila Mejia. We are to talk about security in the search room. Biosecurity is the of prevention measures that aim to protect the health and safety of staff, users, and the communications against different risks produced by biological, physical agents, chemical.
Personal protection elements in the surgical area are of vital importance science. They constitute a barrier between the sources of contamination and the patients or the staff. These protection barriers we need a gown, a hat, the gloves, the mask, and the gaiters, without forgetting the later in the procedures that the rows of RX is necessary. Also keep in mind that the noise must be short without enamel and not wear jewelry of any kind.
I'm going to talk to you about the use of gloves and proper handling of sharps. The recommendations to take into account regarding the use of sharps in surgical interventions are the following. Hold the needles with a needle holder during the procedure and while placing it to college during the intervention. Use forceps rather than fingers to hold needles during procedures. Verbally announce the pacing of sharps. Avoid hand to pace of sharp instrument that should be left in neutral area or transfer tray. Use other alternative curing methods, for example, electrosurgical knife. Use rounded scalpel blades. Use scissors instead of a scalpel if the procedure is allowed. Have spacers and forceps of adequate length to prevent the hands of the personnel supporting the surgery from being at risk of being punctured. Once the procedure is finished, remove the scalpel blade with the help of the forceps and take it along with the suture needles to the guardian. Once the sharps can be used, they should be discarded inside the guardian. Refrain from reaching into the surgical field to search for a needle for the suture. Use the needle holder and dissection forceps. Use of gloves. Decreases the transmissions of the microorganisms for hands of the personnel to the patient during the procedure surgical. Thank you.
Hi, I will comment on the moment of jet washing. It must be done before getting to work, before and after treating each patient, and after performing each procedure, before putting on gloves, after placing any contaminated instrument, after being in contact with body fluid, after room glove.
What my parents have mentioned, the biosecurity manual demands vaccination protocol. It consists for hepatitis A and B. That the second dose 1 month after fifth one, and the third dose until the sixth months after the fifth dose. Furthermore, we found out the varicella of or popped, where they consist in a pulse twice, where the second is a month immediately after the fifth dose. Tetano, which is more important, we are exposed to a sharp and infection objects. The vaccination ships are the three. First one, second dose after month and after 6 months from the first. As to the hepatitis protocol 2, we found all tuberculosis. In this case, we all certification it will or shall use first identification or a spututers. Indeed, influenza vaccinating protocol is yearly and triple viral vaccination. The first dose and apply the second dose 10 years after. Thanks for theirs.